Hello, I am Tina Zimmerman and I'm here with Carissa Miller to discuss safety in the sun. We are HealthLink Community Outreach Nurses with the University of Maryland Upper Chesapeake Health, and we're really happy to be with you today. We want to spend some time discussing the importance of being safe when you are in the sun because we want you to minimize your risk of skin cancer. We will be discussing the risk factors for skin cancer, prevention techniques, the importance of screenings, the 3 major types of skin cancer, and how to do a monthly self-skin check. Skin cancer is the most common type of cancer. According to the Skin Cancer Foundation, 1 out of 5 Americans will develop skin cancer by the age of 70. Close to 10,000 people are diagnosed each day. For this reason, it is so important for us all to take measures to help prevent this type of cancer from occurring. As you know, a risk factor is anything that increases your likelihood of developing a disease like cancer. When it comes to skin cancer, there are several risk factors that can contribute to this disease starting. Fortunately, many of these risks can be addressed by you. We know that anyone can get skin cancer, but people with certain characteristics are at a greater risk. So it is important to know if you fall into one or some of these risk factors. Your skin type is a major factor for skin cancer. So there are 6 types of skin, going from very fair to very dark. If you know your skin type, you can help predict your overall risk for getting skin cancer. Those with darker skin have more pigment to their skin, and that protects them from the damaging rays of the sun. So, people with less pigment are at a greater risk. If you have blonde or red hair, light-colored eyes, and if you freckle or sunburn easily, you are at a greater risk. But please understand that people with darker skin can still get skin cancer. Bob Marley, the singer-songwriter that introduced reggae to this world, died of melanoma, a type of skin cancer, at age 36. Regardless of the type of skin you have, everyone needs to practice a complete prevention program and have regular skin checks. If you've had 1 or more blistering sunburns growing up as a child or as a teenager, that does increase your risk of having skin cancer as an adult. But also, having sunburns in adulthood also increases your risk. Anyone who spends too much time in the sun without good sunscreen or clothing is at an increased risk of developing skin cancer. Tanning, including tanning beds, tanning lamps, certainly puts you at a risk for skin cancer. Did you know that a tan is actually your skin's response to injury from the sun? So while a tan may look really good, it's not that good for you. People who live or vacation for long periods of time in sunny, warm climates such as Florida, they're exposed to more sunlight. And so that increases their risk for skin cancer. Another risk is living at very high elevations because there the sunlight is much stronger, and that also exposes you to more radiation. People who've had many moles or abnormal moles are at an increased risk for skin cancer. These abnormal moles, which look irregular and are generally larger than normal moles, are more likely to become cancerous. If you have a history of these abnormal moles, please watch them carefully to see if there's any changes occurring in them. If one of your parents, or if you had a brother or a sister that was diagnosed with skin cancer, that also increases your chances of getting skin cancer. If you develop skin cancer once, you are again at risk for developing it again. People with weakened immune systems have a greater risk of developing skin cancer. This includes people undergoing treatment for cancer, those having HIV/AIDS, and those that had an organ transplant requiring them to be on certain medications that suppress their immune system. Skin cancer risks increase as you age, which is likely due to all the accumulated exposure we've had to UV radiation. And finally, smoking. Smoking is also a risk factor. Did you know that smokers have triple the chance of getting skin cancer?
We all know that year-round prevention helps decrease your risk of developing skin cancer. You want to use broad-spectrum, water-resistant sunscreen that has an SPF of 30 or higher. You also want to make sure that you apply it 15 to 30 minutes before sun exposure. And after about 2 hours, or whatever it says on the bottle, you want to reapply it again, either after swimming or toweling off or sweating. Make sure you check the expiration on the bottle because sunscreen does expire and you have to store it in a cool, dry place. And these are the do's and don'ts for going outside. Whenever possible, cover up with a wide-brimmed hat, sunglasses that provide 100% UV protection, long sleeves, long pants or skirts, shoes that cover the entire foot. You may also try to seek shade or use an umbrella. Avoid sun exposure between 10 and 4. And as Tina had mentioned, avoid tanning beds or sun lamps. In addition, talk to your healthcare provider or pharmacist about any medications such as antibiotics or allergy medicines that increase the sensitivity of your skin and eyes to UV rays. Lastly, screenings can help identify changes in your skin that might lead to cancer. It is best to talk to your provider or dermatologist about how often you should get screenings. There are 3 common types of skin cancer. Basal cell carcinoma is the most common form of skin cancer. It grows slowly, but it's very treatable. It kind of looks like a shiny or pearly bump, but it could also look like psoriasis, eczema, or a cut that doesn't heal. Among those with darker skin, about half of the basal cell carcinomas are of a different color, like brown. They are most often found in sun-exposed areas such as the head, the neck, the arms, but they can also be found elsewhere. Squamous cell carcinoma is the second most common form of skin cancer. It also grows slowly, but it can grow deep and spread to other parts of the body. A majority are treatable, but some are deadly. They can look like scaly red patches, or warts or open sores that would not heal. At times, they may even crust over or itch or bleed. Just like basal cell carcinoma, they are often found in areas exposed to the sun, such as your head and neck and arms, but again, anywhere else in the body.
Melanoma is a very serious form of cancer that begins in the cells of your body that give your skin their color. While it's less common than those that Carissa just discussed with you, it is more dangerous because it has the ability to spread to other organs in your body, and it spreads very, very quickly. So it's very important we catch it at an early stage. People call melanoma an aggressive form of cancer. So many people think that melanomas just occur in existing moles you already have. But did you know that only 20 to 30% actually come from existing moles? So that means that 70 to 80% of melanomas actually come from your normal skin, not from the moles. Melanomas have certain characteristics, and we call that the A, B, C, D, E's. So A stands for asymmetrical. If you draw a line through the middle of that melanoma, the two halves do not match. In a normal mole, they do match. The B stands for border. Melanoma borders tend to be very uneven and maybe even have notchy-looking edges. Common moles have even borders. Multiple colors are also a warning sign. Non-cancer moles are usually a single shade of brown, and melanoma may have different shades of brown and tan or black. As it grows, the colors red, white, green, or blue may even appear. The D stands for the diameter of the mole. It's a warning sign if a mole is the size of a pencil eraser or larger, and a pencil eraser is about 6 millimeters or 1/4 inch in diameter. The E stands for evolving, and that means changing. Any change in size, color, shape, or elevation of a spot on your skin, or any new sign in it, such as bleeding, itching, or crusting, may be a warning sign of melanoma. When you look at the moles on your body, most normal moles look like each other, while melanomas stand out sort of like a sore thumb. This highlights the importance of not just checking for irregularities, but also look and compare the moles on your body. Determine if they look different from their neighbors. These moles can be larger, smaller, lighter, darker. They just don't look like the other moles. Also, if you spot a mole off by itself, you'll want that one screened by your healthcare provider. As we have discussed, when caught and treated early, skin cancers are highly curable. And in the early stages of skin cancer, you are the one with the best chance to see these changes. That's why it is highly recommended that you examine your skin head to toe every single month. It is a simple but very powerful tool to look at yourself, and it could save your life. Begin by examining your face and your neck carefully. Look especially at your nose, your lips, your mouth, and both the front and back of your ears. Use mirrors to get a better view. Thoroughly inspect your scalp. With your hands, separate your hair into sections and use a mirror to view each section carefully and looking for anything different that should not be there. Check your hands, including both the palms and the backs, between the fingers and the fingernails. Continue up your wrists to examine both the front and back of your forearms. Scan your arms by standing in front of a large mirror. Begin at the elbows and examine all sides of your upper arms. Don't forget your underarms also. Inspect your chest, your back, and your abdomen, looking for any unusual markings or moles. For females, it may be necessary to lift the breasts to view the undersides. With your back to the large mirror, use the hand mirror to inspect the back of your neck, your shoulders, and your upper back. Still using both mirrors, scan your lower back and your buttocks. Do not forget to also inspect your pelvic area. Next, sit down and prop each leg in turn on a stool or on a chair. Check the front of your legs and then use a hand mirror to check the back of your legs. Finally, finish with your ankles and your feet. Be sure and check the bottom of your feet, between your toes, and the nails. Remember, prevention and screenings are so important to help prevent skin cancer.
For any questions or concerns, please call your healthcare provider. Or, if you do not have one, you may call University of Maryland Upper Chesapeake Health's Healthlink Department at 1-800-515-0044. You may also call the Harford County Office on Aging at 410-638-3025.
Thank you so much for taking the time for viewing this video, and please stay safe in the sun.